Thank you. Thank you, everybody, for coming back to the meeting. And we are now be in a discussion panel. So first of all, thanks to all our speakers for that. And we'll start with a couple of general questions to everyone. So if please take 2 minutes, no more than 2 minutes for the next question, that'd be greatly appreciated. And I'll start the first question is, would you recommend specializing in a clinical or methodological area? And when in your career should you do this? Stephen, can you please give us your thoughts on that?
I mean, I think the methodology for me has come from my work. I just evolved to work in sample size calculations, and that's because I used to do a lot of study designs. So I gathered that, but most of the methodological work I've done, which is like rare diseases at the moment, adaptive designs, benefit risks, that's come from my job. So some of those things like spun off from my job. Sample sizes is something that I've kept throughout my career, but again, at the moment, it ties in with my work. With regards to clinical specialties, there's a couple of exceptions, but personally, I'll say I wouldn't. I've always tried to stay away. Says someone who likes to work in asthma. Asthma is just something that I've developed as a personal interest. But like when I used to work in industry, we used to flip around clinical teams. And then where I am now, some people do express a preference of being in one area, but we tend to mix people up because then you get different challenges. The two exceptions would be oncology, which we've got people here talk about oncology, and early phase trials, which are particular challenges. And so people, yeah, they're very different areas to everything else. But my answer would be methodological area. For me, it's always come from my job, and therapeutic areas, I personally wouldn't, but others might have different opinions on that.
Thank you very much, Stephen. I appreciate it. Judith, would you like to add your experience and your thoughts to that, please?
Hi. So, yeah, I guess I've sort of done the opposite, really. Not necessarily deliberately. I think I once I'd got into cancer trials, I probably wanted to stay in cancer trials. And I do really think that we see the benefit of statisticians who really understand the clinical pathway and they really understand the data. So, I mean, for me, that's turned into be breast cancer, but obviously across the unit, we have trials across all different disease areas, but you really notice it if we take on a new disease area where the treatment pathway and the types of events, the types of experience and the side effects that patients are likely to get are not as well understood. So I think people can really sort of learn and understand that, but it probably goes a little bit wider because, what drives me now isn't just obviously getting the answers to clinical trials, but in really understanding that care pathway and sort of working with clinicians in the UK and internationally to sort of look at the totality of evidence clinical research as a whole, you might say. So a piece of work we've recently done is on inappropriate use of endpoints, and that was the work done with the National Cancer Institute in the States, because I'd been shouting out about inappropriate endpoints for de-escalation trials and non-inferiority trials where the risk a false negative, false assurance that a drug was not inferior just because they've used the wrong endpoint, that sort of clutters at the endpoint with lots of events that can't actually be attributable with treatment. So for me, not deliberately, but I've really, I guess, enjoyed and now sort of see myself getting into a specific disease area. So it comes back to sort of horses for courses, really. It's what drives you. You may be agnostic to the clinical disease area, or you may really get into that clinical disease area and decide that that's where you want to lead your expertise.
I suppose I was actually agreeing with Judith because actually cancer is a completely very complicated, very specialist area. Whereas if you're working in depression, anxiety, things like that, the issues are more generic statistically than oncology.
Yeah, I guess we get both early disease trials and cancer in my unit. So, yeah.
Thank you very much, Judith, for the insights and Stephen for coming back to that. Catherine, over to you.
So in terms of, I mean, when I started in the NHS, I couldn't specialise in a clinical area because there was just me doing everything. So I think we are trying more so now. I mean, we've certainly got one member of staff who is 50% in respiratory, and I'm finding that she's been able to develop a stronger understanding of that area. With 11 years of experience behind me in the NHS, I'm still chopping and changing around areas, but because I've done so many of them, I can at least get an understanding. And I do agree with what Judith says, that when you pick up a protocol, it's very useful if you can actually read it and understand where the clinician's coming from in their thoughts, because then it helps you to be able to see whether, is the statistics the most appropriate way of answering the question, and how can we make this a stronger piece of work. In terms of statistics, I think because we don't tend to do a lot of our statistics is probably on the simpler scale of things, and it's sort of every now and again when somebody decides they want to do something more advanced, like prognostic modelling or meta-analysis, we are trying to sort of develop an area, so maybe one person's going on a course on something so that they can be that expert for us. But a lot of the time it's more about working out, if we don't know the answer, who else are the experts.
So thank you very much, Catherine, much appreciated the insights. Teresa, I know you touched on this a little bit, but in your presentation, but I don't know if you want to elaborate any further to what you.
Yes, I agree with Catherine. I think it's we tend to be generalists, but again, we will call on other expertise. So if we're doing using a new statistical method, for example, we'll reach out to academics who are experts in those, and so they might review our statistical analysis plan or advise. So yeah, and as I said in my presentation, I think it helps to be a generalist in my area of work, but being able to draw on that, and the other important part of our work is being able to present findings in layman's terms, and I think that probably might be easier as well if you're a generalist.
Thank you very much, Therese. And Lynn, over to you. I know you went on so many courses, so please, elaborate further and tell us your insights.
I think it's a really personal preference. So some people love to be an expert in a narrow field. But what I have seen from moving into different therapeutic areas is there can be an approach used in one area which is actually really useful to transfer to a different one. So you can bring to that group of people different expertise and experience that they wouldn't have had if you hadn't moved from different areas. So I think it's a balance. I know a lot of people that have done sort of 4 or 5 years in one therapeutic area and then just said, you know what, I'm ready for a break. Same old, it's just churning out things, and perhaps they're not getting into doing the actual changes on the clinical side, and it's just the same stats, and so they want then that change. But I think it's just personal preference. And what I would say is that you don't have to move companies normally to get variety. You can go to that company and say, okay, I'm just bored of this project. Could you give me another project that's doing something different? And I think that's a mistake I've made over the past of thinking, oh, I need to move companies, when actually you could stay with the company, just get a different project.
Thanks, Lynn, for the insight. So our next question is from Harry, who thanked everybody for their talks. And he asked, knowing what you know now, what advice would you give yourself now to early career researchers? So what would you have told yourself, actually, if you were going to start now, basically, on your journey? Judith, shall we start with you?
Harry knows me well because he works in my unit, and I don't honestly have an instant answer to that. What I would say is, yes, keep making sure that you're enjoying it and the work-life balance. But do think about what opportunities you actually, you might have, because there are, you've heard from today, there are so many different opportunities across the different types of career. what I would certainly say is make sure that you remain proud and respectful of your profession. That we think one of the things we've heard across the board is we have some great clinical colleagues that we work with, but equally there can be some times when statisticians might be treated a little bit more as the service provider. And I would say never let that get to you. I don't think I ever did, but I'm not sure it always made me friends. So be sort of perhaps find the way to be quietly assertive about that throughout your career, and it will help you along your way. But look out for opportunities, because I've traveled to all various places and met whole different groups of people that I never thought you could do as a statistician. So just look out for opportunities as well.
Thank you, Judith. That's really insightful. Catherine, what would you like to bring?
I think one of the main things I remember our stats advisor, when I first started working at the Trust, sort of teaching me is there's a very important little word. It's called no. And when somebody's standing there and telling you that their project is the most important thing in the world and it needs to be done yesterday, and why haven't you done it? It's learning to sort of tactfully say to them, well, you should have come to me 2 months ago. But, and if you'd have come to me 2 months ago, I'd have been able to help you so much more with this. But now you've left me 5 minutes before you want to submit the grad deadline, and actually, no, that's not going to work. And I'm getting there, but it takes practice. But
I would second that one, Catherine. You have to be able to do it.
Yeah.
Don't be afraid as to who you say no to. It might be a clinical fellow associated with your boss. Doesn't matter. If they come to you the day before or the week before, you go, nope, it's not going to happen. And why? Because it's your reputation on the line as well, I think.
Yeah. I think the other thing that sort of relates into that is there are some people out there who like to throw their weight around because they are professors, or they think you should be impressed by where they are. You maybe are, but don't let them shout you down. And we are the same level. I mean, one of my juniors keeps saying, "Oh, do I call them Mr.? Do I call them by their name?" No, they are your colleague. You are working with them at their level. It's just you're an expert in something else.
Thank you very much, Catherine. Much appreciated. And yes, you have to be able to say no, but it takes courage to say no as well. Therese, please, over to you.
Yeah, I think so. I was quite happy-go-lucky in my early career. I sort of just went from one job to the other that sort of fitted in with what I was doing. I think I was very, very lucky to get back into what I really enjoy doing. So at university, I actually started off by doing philosophy and French literature, and then tried law, which I hated, and then went, oh, I suppose I'll just have to do economics because I couldn't think of anything else. And then as part of that, I did statistics, and then went, oh my goodness, this is what I love doing. And then I sort of diverged from that, and I was extreme, and and I wouldn't undo the co-founding of a startup. That was great fun, but I was very, very lucky to get back into statistics. And in retrospect, it could have just as easily not worked out for me. So I would say that although, and a lot of us actually have sort of slightly had a roundabout way of getting to where we are, I think there is something about making sure that you hold on to the things that you really enjoy, and maybe having a little bit more of a sort of view of where you want to go.
Thanks, Therese. Lynn, over to you.
Yeah, I mean, I'd say it's a very small world, statistics. So, you meet lifelong friends here, but also if you do end up in, having a problem, or always treat people with mutual respect. Don't underestimate your soft skills, your negotiation skills and communication skills. When you do have to say no, explain why, and say, look, I really want to do this for you, but you've not left me any time. I can't assure the quality of it. So if you can explain, the rationale behind it, that you need to stick to your ethics, you need to stick to the quality of what you're doing, because that is what's important about interpretation of data, then hopefully you can get people on board to why it's a no. And then I'd say as well, if you're ever unhappy in what you're doing, don't just keep going, like address it, talk to your line managers. describe what the problem is, try and resolve it with them. And if they really can't resolve it, it's just not possible, make a change, because there's no point sitting in something you're not happy with doing.
Thank you, Lynn. Stephen, what would you like to add to this?
Yeah, it's actually one of our, as I'm looking at all the people here in the talks, is something someone said to me years ago, is that you haven't got a job for life, you've got jobs for life. And my thing is to continue to develop and train. Now, the extreme ones is Lynn taking the time out to do a PhD, and I when I did my PhD, I worked part-time, but you don't have to do that. I ensure in my section that everyone has the training part of the development plan all written up. And early in your career, it doesn't have to be going on a course. It could be doing your job. Some people say they've never done they've been here 2 or 3 years, never done a randomization. It's how the dice have rolled. They've never done a SAP. So you could say, I want to do a SAP, and that happens. It doesn't have to cost my department money. So you can actually put in your training things so you become a more rounded statistician. And to continue to develop, if you think, well, I've not done this, I've not done this, I've not worked on a cluster trial, and things like that, and we can actually make that work. So my thing is to keep developing and keep training. And the training doesn't have to be a course. It can just be garnering experience, which your department could just do by actually prioritizing the projects towards you.
Thanks, Steve, for this input. As well, the next question comes from Paula, who said, a question for any of the statisticians talking today. I shouldn't have said that, but I'll carry on. Is it common for statisticians to work with economists? I find that there are many common grounds between the two fields, but different wording, approaches, and priorities, which may end up segregating the two fields. I wonder how this is outside of academia. Catherine, would you like to start us with, if you're happy to address this?
So, sort of going slightly back on what she said, when I worked for Manchester University, we did have an economics group, and it very much saw what Paula said, that their language is so different. So now I'm in the NHS, it's a little bit, it's sort of a bit of a pipe dream that I keep having to explain to my line manager, that we're unlikely to get somebody who is both an economist and a statistician. We have to either advertise for one or the other. We do try and have links into economics, because a lot of our studies will at some point in time want to do some form of cost-effective evaluation. So our current aim is we tend to try and get an economist from somewhere. I'm on a couple of trials. So some of them have come from industry, and they seem to be paying them a ludicrously large amount of money to be involved on the grants. So we aim to work with them, but sometimes it's hard to actually get hold of one and get them interested.
Thank you, Catherine. Therese, would you like to come in?
So within the Health Foundation, we also have an economics team called the Real Centre. And actually my first job at the Health Foundation was a joint fixed term contract between, so half of my time was data analytics and the other half was economics, even though I didn't have a degree in economics. And I'm always surprised at how similar their work is to ours. And I don't know if that's specifically in the Health Foundation or in general, but I think that there's a lot of overlap in my experience.
Thank you, Therese. Lynn, your thoughts?
Yeah, I think there's areas in pharma that you can actually move between the two. So at my previous company, Faster, we had like a real world evidence econometrics group that do all the cost benefit of the drug and make all the decisions and work with the regulators on any kind of econometrics that they need. People often came into us with a bit of a couple of modules in that and then went into that group. And if they didn't want to carry on in that group, they could then move back into more the clinical trials. So I think there is room to move between the two. I agree with the terminology. That's a common thing in stats. I find in lots of different statisticians from different backgrounds also have different terminology. And yeah, just always saying, I'm sorry, I'm not following what you're saying. I don't use that word. What do you mean? That's a useful thing when you say pattern mixed modules versus multiple imputation, or, you know, they, it's often you find different words. So I don't think there's that much difference in the essential work or the principles, but yeah, it's just getting over the terminology issues.
Thank you, Lynn. Agree. You need to communicate that and be clear about what each of us mean by things. Stephen, over to you.
Yeah, well, my school, we've got a big health economic department, and all our studies look at clinical and cost effectiveness. And then we've got the medical stats group, which cuts across the departments as well. So I just listed there are 4 statisticians in the health economics department, and there's a couple of health economists who call themselves health economists but were originally statisticians, and then or they've retrained. And then there's 2 who are both. There's actually Professor Tracy Young and Dr. Laura Flight. They actually sit. They could actually go both ways. They could be health economists or statisticians. They sit at the bridge. So they're not mutually exclusive. There are people who are card-carrying statisticians who work in health economics. There are health economists who were trial statisticians at one time and just moved over. And there are people who do both jobs. That's in my school how it works. So it's not like a black or white thing that people work in.
Thank you, Stephen. Much appreciated. Judith, over to you, please.
Sorry, I was trying to unmute. We tend to work with a collaborating group of health economists, but I would second the comment that, sometimes that works really well. Other times it can be very difficult to get somebody to be involved, because, in fairness to them, it's not their main interest to just sort of agree now to be involved in a trial in 5 or 10 years' time. So I think it would benefit the profession to broaden that sort of cross talk between the groups.
Thank you very much, Judith. The next question as well for all the panel, and I'll start by Teresa's time round. You've all mentioned that you accidentally ended up in your career. Do you think it's possible to do that now? And if not, what recommendation would you give with that in mind?
I don't think the landscape has changed. I think that would just as much happen now. Yeah, I think, yeah, sorry, that was a very short answer, but
No,
yeah, I'm not going to...
fine, we can move. Lynn, would you like to add to that or get another angle? Thank you.
Yeah, I mean, I would say there's still quite a shortage of statisticians and a continual open job market where people are advertising for statisticians. So you may see a job advert that you think, well, I don't have the credentials I need for that, or that I'm not completely qualified for it. But if you like the look of it, then apply. They might be interested in upskilling you to that and training you onto it. So I think in that way, you can fall into any area that we've discussed today. And if you don't like it, you can try something else. So I wouldn't worry about limiting yourself. Sometimes it might be a sideways move rather than continually progressing up, which is what would happen if you stayed in the same area. But then if that's interesting to you, then hopefully that's not a problem.
I think from the time that, well, I mean, obviously I'm probably at the older end of the spectrum, but I think certainly over my career, I've seen things change a lot. They've probably changed in 2 ways. One is that there is a lot more availability of PhDs for methodologists than there were by the time that I was training. You didn't have methodologist PhDs in the same way. You'd have to think of a clinical project to sort of run under PhD. So I think there's still room for people who have ad hoc careers, and we certainly take people from all sorts of backgrounds. But I think there are more opportunities now for that sort of more academic training. But the other big change, and I think we've only probably just seen the beginning of it so far, is the influx of what might be loosely called data scientists, which obviously spans a whole range of people who probably are using quite classical statistical methods to people who are using very different methods. And I think that is going to be not a negative issue, but it's going to be a real consideration for statisticians moving forwards as to how we sort of really perhaps grow sideways into those other areas.
Thanks, Judith. Stephen?
So was there a question about doing a PhD, Mona?
No, it's about, you know, how you accidentally ended up in your career, and do you think that's possible to do that now? And what recommendations would you give with that in mind?
Yeah, I think everyone has a bit of thing. I mean, how I ended up in Southampton, I actually got 3 job offers from my MSc, and Southampton were the first one to offer me, so I accepted them and turned down the next 2. I could have ended up going to work for Lilly or Wellcome at the time. So there is that forks in the road. You do have these forks in the road, often looking back. And it is hard, because how do you become a statistician? It's just like we all said, we did it by accident. And one of the issues I've got is actually giving people the opportunity to find out about statistics. Then IHR used to fund internships, and it was so successful they stopped funding it. So we do need to stop the accident and actually have it so people make a conscious thing. And then when you're early in your career, you do almost go where it gives you the job, really, and then that does decide things, how you at the direction of travel.
Thank you, Stephen. Catherine, please, your thoughts on this.
I think there are some things that have changed. Certainly when I was doing my degree and I went to the careers advice, you know, what do you do with a maths degree? And you go and work in a bank. And the careers department just couldn't imagine any other job that you might possibly do. I think there is always, because I seem to have got a lot of my jobs by putting out appeals on Allstat or by talking to people, I think that opportunity will always be there, because having spent a considerable part of last year trying to interview and appoint to posts within the NHS, there is a shortage of people who show the right sort of skills. And as I said to one person who applied, it's not necessary, we're not necessarily looking for the exact qualifications. What we're looking for is somebody that shows potential, in that actually is showing enough now so that they can pick out where they've got the strengths, and you can see in them that they can be trained up. And you know, this is why we have got quite a few junior statisticians, because that's what they've displayed. So those opportunities are still there, and it is going to be interesting to see what happens with the overlap of data science. We're starting to see it coming into projects more now, and we do have a group of data scientists. So, you know, things may evolve yet.
Absolutely, definitely, there is quite a bit of work. You know, what is a data scientist, and how do we, you know, what's the commonalities and differentiation? So we still work, you know, quite a bit on that front. So now I'm moving to more specific questions from, you know, to the speakers. So please, I'm conscious of time, so if you can keep it short and sweet, that'd be greatly appreciated. And I'll start with Stephen. First question is to you from Faye. Why did you decide to move from pharma back to academia? Unusual to see it that way around.
Yeah, I mean, it is. I mean, but actually, Lynn is an example. I mean, like, the jobs are very similar. Obviously, you get paid a lot more in pharma, but it used to be I got a good pension in here, and actually the pension now is worse. But anyway, part of that. It was just a decision. I mean, the jobs are very similar. When I was in pharma, I was doing a PhD part-time while working in pharma. So it was very similar roles. And it was just a time of life thing as much as anything. And this job came up, and my main hobby is walking in the Peak District. I had nephews and nieces who were 3 and 4, and I wanted to see grow up and things like that. So I moved up to be nearer family and friends. And it's a very good job. I really enjoy my job. I've been here 18 years now. And so it was a time of life thing that I decided to move back.
Thank you, Stephen, for telling us your journey. Catherine, the next question is for you, and it's from Paula. When you are the only statistician, do you feel like there is a risk of isolation? or isolating yourself from the statistical community and not keeping up with the frontiers of research in terms of statistics? Do you manage to speak about your work to other statisticians so as to have someone to agree/disagree with in any way? Over to you.
There is a risk. I think the advantage with our role is that we were able to get honorary contracts with Manchester University, and at the time, obviously in the pre-COVID world, I had to make a sort of a real effort to actually go to their meetings and link in with people. I was fortunate, but two reasons. One coming into my role, because I'd been in academia, I'd already built up some connections. So it was a point of making sure I kept them. My other advantage I have is I'm married to a statistician, so I can never be completely isolated. But yeah, you do have to work harder, but there is more opportunity now through things like this and through other groups to actually build those networks outside and into academia to keep yourself in touch with things. Yeah. Okay.
Thank you very much, Catherine. Therese, a question for you from Mariana. Not many of us can afford to work for free, even for charities. It sort of lowers the standards for everyone as well. Your thoughts on that, please?
She's absolutely right. Absolutely right. I maybe should add that they did pay me once I came up with this project looking at the lifetime risk. They did actually pay me. So so it was only a couple of months that I worked for free. As it was, I wouldn't have been able to take a proper job at the time anyway, because I was just recovering from having been ill for quite a while. So 2 days was the maximum I could do. So it kind of worked for me, but I am, yeah, she's absolutely right. I'm very, very lucky to have been able to do that, and not everybody can do that.
Thank you very much for insights. Lynn, thank you for responding to the other questions. Probably won't get around all of them, but I think the first question was for you from Harry. Is there a scope to pursue a methodology leadership role rather than line management? I think when you're in industry.
On mute. Yes. And as I said, yeah, definitely. There's options of staying fully in technical role, doing methods and being a technical expert in the methods, and just saying, I don't want to do line management. Just be honest with your line manager and tell them you don't want to do that. If you want to mix, you can do line management with a few people. But yeah, your choice. And definitely there's a route, and they're equal level. It's not that line managers get paid more or get more opportunities. The technical people as well will have a lot of options and similar career progression with 2 different job titles.
Thank you, Lynn. Stephen, the next question is for you from Paula, and she asked, how does funding of an academic work does it change a lot across academics and over the career?
I mean, my university, and I think it's pretty consistent with other universities. It depends what role you're doing. So if you've got a teaching role, so I'm funded primarily to do teaching. So I'm what is known as core funded. So I'm funded to do that. And then within my section, we've got the clinical trials research unit, and there is core funding with this. The university has invested in staff within because they think it's interesting. So there are core funded staff within there as well, and core funded statisticians. But also most of the statisticians there will be funded by grant income. So they have research grants which fund them. It's relatively stable, the CTRU. I mean, I always say that people, like, if you went to work in a farm for another company, we tend to say, like, I don't like this. We say 3 years in the 3 years fixed term contract. I used to stop having that. I was like, say 3 years in the first instance. What it means is you got 3 years funding guaranteed. Then we're relying on other grants, but then that's true of any business. So they tend to be funded by research grants, most of them, but our income has been relatively stable for statisticians. As anyone keeps pointing out, there is a shortage of statisticians. and we can keep adding statisticians and still keep funding them. So it is a relatively stable career financially in terms of funding them.
Thank you very much, Stephen, for this. I think probably last question to Judith. You mentioned that you felt you're being finally recognized in addition to clinical colleagues, basically, which is great. What tips might you give our early career researchers in terms of getting that 20%, making the worthwhile compared to your 80% of administrative work?
I guess I would say lead by example. I think, I mean, it is very different. We are a hugely bigger profession now than when I started out. So, I like many people have spoken, I was sort of one of the only statisticians. So if I spoke up and shared my views, politely, you might say, but in a consensus way, in a sort of, it didn't matter if there were 19 clinicians and one statistician, if I explained why some interpretation wasn't quite right and how you're empowering your colleagues that they can actually better understand. If you explain to them how there's been gently how there's been a misinterpretation, then they will respect you. And I think so I think that that doesn't hurt anybody to do that really from the outset of their career. But hopefully what should follow on from that then is the respect actually in people recognizing the intellectual contribution that those individuals have made when it comes to study authorship. I would encourage everybody to push for study authorship and push for a placement in that. So whether it's joint first author, second or third author. I mean, I guess we've been very fortunate as a CTU because we have a lot of good established collaborations that it's understood that for main clinical papers we expect a role. The senior methodologists will have either senior authorship or joint senior authorship. And the statistician who has done the work will, at project funded level, will have a place in the sort of first 2 or 3. And that's just known as our modus operandi. So I think that's what early career researchers should be aspiring to. But it's up to those in more established positions to facilitate that for people as well. Because sometimes people will need a helping hand to make sure that those arrangements are known as the expectations of the collaboration.
Thank you very much, Judith. And I think by this, we need to wrap up today's session. So thanks again, Judith, Catherine, Stephen, Theresa, and Lynn for your help, for your insights into your career journey. And I would like as well to thank specifically Jen, Amanda, and Abby for making this happen. I think thanks as well for all our speakers for adding comments and responding to questions that we were not able to put live to our speakers. Much appreciated. There would be recordings available at a later date, basically, and we will communicate that to you as well. We'd like, I don't know, Amanda, if you're able to share the link to the feedback form, that'd be greatly appreciated. If not, if the feedback form is not uploaded now, we'll send it to you, and we'll greatly appreciate it if you can. Let us know, what did you think of the event? Is it, did it help in any way for you? And is it worth us putting it up for other audiences as well? So much appreciated. Sam, thank you very much for leading on that. And I don't know if we'd like to add a final word before we close today's meeting.
Thanks, Mona. No, just thank you also to all the excellent speakers, and thank you to all the participants as well. Great questions, and I think that was a really interesting panel discussion. So yeah, thank you very much.
Thank you. Have a lovely day, everyone. See you soon in some form or shape. Okay, bye-bye.